I am in ultrasound today and just finished reading the ultrasound of a set, of 22-week mono-die twins, which means that they share the same placenta. It was one egg, fertilized egg, that split into two, and they are identical. We do increase surveillance with ultrasound on mono-die twins, and today something changed. Let me show you. The first red flag was all of this fluid around twin A. And twin A is just kind of floating around in all of that fluid. And then as we're kind of looking at the spine of twin A, you see twin B is kind of stuck up there close to the uterine wall. Now the overall growth of twin A was perfect, but here's twin B, and it's curled up and kind of stuck up towards the placenta at the top of the uterine wall. What's going on? And still that twin B is just hanging out, hugging that uterine wall and not really moving around in a lot of fluid like their sibling. Now, towards the end, this happens to be the deepest vertical pocket, or the largest pocket of fluid on twin A, which is about 13 centimeters. And again, here's the abdomen of twin B, still stuck to that uterine wall. And the deepest vertical pocket of fluid around twin B is about 1.5 centimeters. And then finally on twin B, we cannot see a bladder. Have you guessed the diagnosis yet? Well, let me tell you. This is twin-twin transfusion syndrome. This is one of the risks of mono-die twins, or monochorionic diamniotic twins that share the same placenta, are in two separate sacs but share the same placenta with a thin dividing membrane in between. That means that they're sharing similar vessels, and one of the twins is getting more of the blood flow than the other one, and that's why one twin has a lot of fluid, the other twin is kind of stuck without any fluid. Stay tuned for the next video where I explain to you in more detail what twin-twin transfusion syndrome is and what the next step is in the management of this patient. First, twin-twin transfusion syndrome can only occur in monochorionic diamniotic twins. That means one egg was fertilized, and at day 4 to 8 after fertilization, that embryo splits into two identical fetuses that share, they have one chorionic sac, two amniotic sacs, so two amniotic sacs, one for each fetus, one placenta, then two fetuses, and two umbilical cords. And this right here is a representation of monochorionic diamniotic twins. Now, each twin has its own umbilical cord. And as that umbilical cord connects into the surface of the placenta, there are blood vessels that run back and forth between the umbilical cord insertions. The blood pressure in arteries is higher than the blood pressure in veins. So if there are more connections from one twin to the other of arteries to veins, then you're going to have more shunting of the blood from one twin to the other through those what we call AV anastomoses. The twin that donates or has more blood flow going to the other twin is known as the donor twin, and the twin that's receiving most of that blood is known as the recipient twin. Twin-twin transfusion syndrome starts with a diagnosis of low fluid or oligohydramnios in the donor twin and increased fluid or polyhydramnios in the recipient twin. And that's because the donor twin is donating more of its blood to the recipient twin. The staging then goes on from there. The twins that I spoke of had stage 3 twin-twin transfusion syndrome, and there's actually a stage 5 as well that includes death of one or both of the fetuses. Now, depending on multiple factors, including the stage of TTTS, patients can be a candidate for fetoscopic laser photocoagulation of the abnormal vessels. And the patient I discussed was a candidate. In this procedure, a trocar is placed through the abdomen of the patient and into the uterus. Then a fetoscope is placed through that trocar to map the abnormal vessel connections on the surface of the placenta. Then a laser is used to photocoagulate those abnormal vascular or vessel connections. The trocar and fetoscope are inserted into the amniotic sac of the recipient twin because it has more amniotic fluid. And this is the face of the recipient twin. They then find the umbilical cord insertion onto the placenta of the recipient twin and map the vessels that are abnormal going from the recipient twin to the donor twin. Once they find those abnormal vascular connections, they then photocoagulate or laser them to decrease the amount of blood flow going from the recipient to the donor twin. At the end of the procedure, they draw off some of that extra fluid off the recipient twin, and hopefully it will start to balance out.